Cancer remains a global burden and leading cause of death. It isn't just one kind of disease. There are many different kinds and affects all tribes, ages, and status. Today on Sound Health, our focus is on access to cancer treatments and closing the care gap. Good evening, I am Olasumbo Modupe. The conversation begins after this break. Please stay tuned.
Last year, I laid out 5 priorities for the coming 5 years. Those priorities have since crystallized into what we're calling the 5 Ps: promoting, providing, protecting, powering, and performing for health. First, promoting health by addressing the root cause of disease, which is essential for achieving our target of seeing the 1 billion more people enjoying better health and well-being. The second priority is providing health by reorienting health systems towards primary health care, which is essential for reaching our target to see 1 billion more people benefiting from universal health coverage. The third priority is to protect health by strengthening the global architecture for health emergency preparedness, response, and resilience. The fourth is to power health by harnessing research, innovation, data, digital technologies, and partnerships. The fifth and final priority is to perform for health by building a stronger WHO that delivers results and is enabled and empowered to play its leading role in global health. As member states, you look to us to provide world-class evidence-based norms, standards, research data, and technical and operational support. And that's what we're doing.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Temitope Andero, consultant clinical and radiation oncologist with NSIA-LUTH Cancer Center, Idi-Araba, here in Lagos. Good evening, Dr. Temitope Andero, and thanks for obliging us.
Good evening. Nice to be here.
All right, Dr. Andero, cancer still remains a global burden. Unfortunately, scientists say there is no known cause of cancer, but a combination of interactions of some other factors. Tell us what exactly this means.
Yes, the issue of cancer has been a global burden and a global concern, and then but as much as that might be, it is so very interesting to know that an average citizen doesn't know what cancer is all about. So I will just try to explain in simple terms as much as possible. Cancer in itself is a disease entity, and we talk about certain cells from certain parts of the body, maybe an organ. They just decide to, due to certain transformations or changes, which oftentimes are not even known, they decide to continue to grow non-stop. Naturally, when a particular part of the body are so naturally designed, like say, for instance, the nose, the eye, the breast, or any other organ. So by the time they reach, everything has been programmed naturally. And then it's expected that once they've been able to reach a particular growth level, they stop. But for some reasons, there are some cells that become abnormal and they continue to grow, due to certain DNA changes from certain factors that we're going to be talking about shortly. Now, one thing that is very peculiar and makes cancer to be of a global concern is because of certain natural tendencies and peculiarities with cancer. So, like I just said, they just continue to grow. Originally, they were normal cells, due to certain changes and transformations, they continue to grow. So why it is a major concern, they do not only grow, but they invade the surrounding tissues, affecting both the anatomy and the functions of the normal tissues around, but they don't even end there. They can also, spread to distant organs. And that is why over time, after some time, it could become so overwhelming to the system or the local organ where they spread to, could be the brain, the lung, the liver. And that is why over time, the system could succumb to the overwhelming effect of this cancer, and that is why it leads to death. Now, talking about causes of cancer, like we do say, the causes, are still not generally known. So, but often we do talk about risk factors or predisposing factors.
All right, let us know what these risk factors are.
What are risk factors? We're talking about certain factors that, if found among certain individuals, either by reason of their lifestyle or exposure to certain risk factors, they are more predisposed to having cancer than average population. That is not to say absolutely that when those things are present in certain individuals, they must come down with cancer. But then it places them at a higher risk. And what are these risk factors? They are multifactorial, right? Now, but what is a common denominator to cancer is aging. We do know that as people age, the tendencies and the possibility of having one kind of cancer or the other increases. And it's just because from day-to-day activities, our cells suffer one kind of damage or the other, especially the DNA, but the ability to repair decreases as we age, right? And those damages over time could lead to certain transformations or mutations that will eventually lead to cancer. One thing that is also connected to age as one of the reasons for developing cancer is the cumulative effect of some carcinogens, cancer-causing factors, that over time, there could be, a level where it could lead to overt cancer. Now, aside from age, of course, we have some genetic factors and some hereditary factors. I mean, we'll talk about family history of cancer. Like if my dad had prostate cancer, for instance, there is a likelihood that I'm at a higher risk. And we do ask these questions a lot when patients present at our various hospitals, having one cancer or the other. We do, especially breast cancer, which is the most common. We ask, okay, has there been any history of breast cancer among, your very close relatives, talking about your mom, your sister, your auntie? But that is not to say that because your mom or your sister had cancer or died of cancer, you must have cancer, but it places you at a higher risk, right? Now, I did mention carcinogens. Nowadays, lifestyles, are changing, especially in this part of the world. We are more and more embracing, Western lifestyles, industrial revolution and everything. So we're exposed to certain carcinogens. We have what we call some physical carcinogens, which could come from radiations due to exposure, occupational exposure to radiation. You're going to be at risk. And then even the natural, radiations from ultraviolet, which is very important. And I'll be quick to mention this. In this environment, you see albinos working in construction companies. I always talk about that. Or at the motor park or various places where they are, excessively exposed to sunlight and the UV light. The people who have one of the most common skin cancers we have in this part of the world, they are albinos. And most of the time is due to exposure to UV light. Chemical carcinogens too are known to be causes of cancer. And one of the topmost among these is cigarette smoking. I mean, it is a known fact globally that cigarette smoking has been known to cause cancer and of course death. What about alcohol? Alcohol has a direct effect, especially when taken in excess, in changing the liver architecture. Liver cirrhosis can arise from there, and some transformation can take place, and consequently, and ultimately leading to cancer. What about asbestos? Lung cancer has been connected to that. We have what we call biological carcinogens too, arising from certain microorganisms that can make people to be predisposed to cancer, like human papillomavirus has been implicated. In fact, about 70% of cases of cervical cancer are, connected to cervical cancer. We have hepatitis B and C virus, right? All those ones are directly connected to, especially when they run chronic causes, are connected to liver cancer. And this will have some synergistic effects in people who are alcoholics. In fact, they have double or triple, risk of having liver cancer. You are a non-alcoholic, and then you are also infected with all these, kind of viruses. Right. Human papillomavirus, I mentioned that HIV, Epstein-Barr virus, and our day-to-day lifestyles too. Inactivity, diet low in vitamins, and especially, vegetables and fruits, sedentary lifestyle, obesity. All these are also connected to, cancer as risk factors.
All right.
Right. And more.
Of all the cancers you mentioned earlier, which is the most commonest, and why is this so?
Yes. Globally, the most common cancer globally, it's in the third world country like Nigeria or in the Western world, is breast cancer. I mean, when you talk about even male and female combined, now if you now want to classify it into male and female, breast still remains the most common. And prostate, is the topmost on the list among the most common, malignancies or cancers. Now, in this part of the world, when you talk about, so generally in this part of the world, you can talk about breast cancer and you can talk about cervical cancer as the two most common in that order for, female populations. And then others, generally, not in any particular order now, breast cancer, cervical cancer, prostate cancer, lung cancer, colorectal cancer, all these are the cancer cases we see in our centers around this part of the world and globally. You have cancer of the, of the stomach, renal cell carcinoma or cancer of the kidney. You have head and neck cancer, and on and on and on. And then I'll be quick to mention as well that cancer is one of the leading causes of death globally. And it's going to be interesting to know that 70% of these cases are found in third world countries like ours, and in part due to, poor screening programs, poor enlightenment programs, and on, right? So, so that is just the way it is.
Current projections show that Africa will account for 50% of childhood cancer global burden. Why is this so, especially in children?
Yes, just like I I mentioned earlier, you see, cancer can actually be found among every age group, literally from infants to the very aged, right? And then even in this part of the world too, this is not unconnected to our socio-economic factors as well, right? As it has been kind of reported according to the research, most of these cancers, like I said, is found among, low socioeconomic class people, of course, in third world country as well. And also, as it is among adults, so it is among children. Talking about such cancers as brain tumor or central nervous system tumor, lymphomas, leukemia,
How accessible is cancer care in Nigeria?
Well, first, I will appreciate the effort so far. Even though I'll be quick to say that the care is still abysmal compared to the population of this country. But I will still give credit to the stakeholders. The government is making efforts, to reach out by reason of maybe cancer awareness here and there, um, you know, cancer fund here and there, trying to collaborate with certain private organizations or certain programs to subsidize costs, in certain uh, uh, health centers or health facilities. However, there's still a lot to be done. Treatment of cancer in this country is still very, very expensive. For instance, like my center, uh, NSIA-LUTH Cancer Center, right? We use state of the art to treat cancer, and it doesn't come very cheap because it takes a lot of money to put all these things in place. So, and it is not what an average population can afford, right? So cancer care is still very, very, it's still expensive in this part of the world. And then talking about cancer care, we're talking about different treatment modalities because the treatment of cancer is more like multidisciplinary as well as multi-modalities, ranging from chemotherapy, surgery, radiotherapy, chemotherapy, brachytherapy, depending on what kind of cancer you're talking about, like cervical cancer. It is not just a one stroke fit all. You have to first customize and design treatment protocol to meet the need of an individual patient according to the international guidelines. And if you must do so, of course, it comes at a cost, and it could be a bit on the expensive side. And that is why, it is not uncommon. Many of our patients, they present very late because as at the time they get to know about the cost, some of them will resort to taking herbal medications and concoctions or go to the church and pray or to the mosque. Right. And then by the time they come back, the cancer is not everywhere. You can almost tell how many more weeks or months they have to live. Right. So, and on that note, we will still continue to appeal to the government, right, to, either kind of put up programs or partner with individuals aimed at ensuring that the cost of cancer in this country is highly subsidized and is brought down to, the level of an average citizen. Otherwise, the cancer burden in this country will continue to rise, and we continue to witness more deaths, due to cancer. And but then I also use the opportunity to mention that treatment is not even, it's not, of course, it's the ultimate thing, but a lot too has to be done from prevention, early screening, and early detection, right? So the government has to put in more effort to ensuring that we have more enlightenment program and screening program for our people, so that when the cancer is detected very early, it can be treated when it is still reasonably curable, or patients have better prognosis and a better survival outcomes. And I must credit LTV for putting up this program, and that is part of what we are talking about. All these programs can help us to disseminate information to let people know and have their awareness about cancer. Some people don't even get to know about certain screening programs. They get to know for the first time when they're already down with the disease. They don't know what is called pap smear. They don't even know what is called mammogram. They don't know what is called PSA. And these are the key killer diseases and the common disease entity we have in this country. I'm talking about breast cancer, prostate cancer, and cervical cancer, and even colonoscopy for colorectal cancer, right?
The World Health Organization Africa says 12 African countries has a valid national cancer action plan. How do we ensure we increase these plans in other countries to compete favorably with the advanced countries?
Yes, there has to be a political drive, if I must put it that way, because we cannot shy away from the fact that a lot of things that will happen in this part of the world or that wouldn't happen, there is a lot of connection with the politics, right? So I think it is time we begin to talk to the politicians, and they should begin to incorporate into their promises and the political dividends to let the population know that, okay, this part of health, as it touches on cancer and the burdens thereof, they will have to, it's promised that they will have to be involved with regard to financing and everything. So there has to be, that awareness across the countries. There has to be enlightenment program across the countries. There has to be, advocacies. Yes, there has to be some advocacies at the government level, corporate bodies sponsoring certain programs, enlightenment programs, and even religious organizations too in all these countries. The government cannot do the job alone, not in any country. Of course, you do know the government has the major role to play. However, it has to be a teamwork across the board, right, in all these countries, so that, number one, there has to be that awareness. Is very key. People need to know, okay, these are the risks of having cancer. There are some modifiable lifestyles that will reduce the risk of having cancer. And when you do have them, this is where you have to go. And you have to be, aware of certain signs and symptoms. And you have to go see your doctor. All these are things we need to find a way to get across to our people. And we also need to let them know that there are certain screening programs, and the government has to put in a lot more effort to making sure all this is already available, everywhere and in all these countries.
Before we let you go, what is your call to action, Dr. Andero?
Yes. Part of what should be a take-home point in all that have been said so far is that, number one, people should know that there is cancer, and that cancer is still one of the known killer diseases globally, and that early detection can actually, save lives, that cancer is not a death sentence, and that, there are individual roles that people have to play. And then to prevent cancer, about 30 to 40%, 20 to 30% of cancer can be prevented through certain modifiable lifestyles. You stop smoking, healthy sexual habits, being very active physically, healthy living, avoiding, certain pollutants, right? Of course, for those that are avoidable. And then, of course, regular checkup. Once you are age 40 and above for women, you must make yourself available for mammogram. It can detect breast cancer in its minute form, and that's, at that stage, it might still be very curable or respond fantastically to treatment. And then there's something called pap smear. From age 21 and above, women should make themselves, or those who are sexually active, and from age 21 and above, should make themselves available for pap smear, which can detect, cervical cancer at the precancerous stage, where it can still be, nip in the bud, in its wake. And for men from age 40 and above, do your PSA, and if you notice that it is abnormally high, you have to see your doctor, maybe for further evaluation, right? There's colonoscopy too. And for age 40 and above, 50 and above, but it can be much earlier. For those with family history of all these disease conditions, they should be a lot more conscious and suspicious of certain things in their body and go quickly, for screening, for early diagnosis, right? So, and by so doing, and of course, when such diseases have been diagnosed, patients will make effort to go to the right places rather than resorting to taking natural medications, and be very wary of people that push so-called natural medications, which we have all around now, and they are nothing but scams, right? And they should go to the appropriate places, see the specialists, I mean, NSIA-LUTH Cancer Center is just here within Lagos, and we do a lot of that as well. So I think together, by so doing, we can reduce the cancer burden and cancer deaths due to cancer-related deaths in this country.
All right, cancer is not a death sentence. Early detection saves life. Make sure you get screened early enough. Dr. Temitope Andero, consultant clinical and radiation oncologist with NSIA-LUTH Cancer Center Idi-Araba here in Lagos. Thank you so much for your time and expertise on the program.
Thank you very much for having me around. My pleasure.
The program is still Sound Health on Lagos Television. We now bring you trending health report from around the world. Please stay tuned. All right, the program you're watching is still Sound Health on Lagos Television. Hope you've been enlightened on this particular episode of Sound Health. 40% of cancer-related deaths are surely preventable. Embrace healthy lifestyle and get screened early enough. If you have topics you would like us to treat, send SMS to 0035826603 or follow us on social media at TLTV Social #Sound Health. A sound health is a sound mind. Make healthy living your choice.